My name's David, thank you. My name's David Kidney, and I'm going to give this presentation on public health workforce planning. I'm going to share my screen in a moment and show you some slides. The good news about this is there are not many slides, and you will get them afterwards as part of your report of the conference, so you don't need to make notes as we go along. So let me do the necessary with the slides. And we'll get started. So in the array about public health, she had a whole slide on workforce at the end. But remember, she described the endeavour of public health is the three pillars: health prevention, health protection, health promotion, and healthcare public health, underpinned by science, intelligence, analysis, and academia. And I would add at that stage, and underpinned by a workforce who know what they're doing. And I think it's kind of a really important part of the equation, is that the people in public health know what they're doing, and that's what I think this audience can demonstrate. What might be helpful, if you wouldn't mind, is pop in the chat your job description. And I think as we read what the different job descriptions are that people put in the chat, we'll see what tremendous variety of roles there are in public health, and how this is very much a case where the whole is much more than the parts. It's a really useful exercise, I always find. So let me just move on then. Tim, in the other plenary session, started with the definition of public health, and so do I. Here's Donald Atchison again, but mine is here to make a particular point. So here we're talking about how we gather the talents of everybody we need in order to address all the determinants of health and well-being, and to address them on a population basis or a population level. And to me, what that says loud and clear is that public health is a multidisciplinary endeavour. It takes the skills of lots of disciplines to be able to do that task. And that's not universally the view of public health practice and public health workforce. There are still medics who will explain that public health is a specialty of medicine, and that it's led by medicine. I kind of profoundly disagree with that view, but it is a view that is still there, and one that we do need, in the nicest way possible, challenge and overcome. And some people also, in terms of analysis of public health, talk about we've reached the fifth stage, the fifth wave of public health, and they go back through the stages that begin with those major works of public good during the Industrial Revolution, you know, the drains, the clean water, the sanitation, and so on, through the emergence of medicine as a science, through the changes in the middle of the 20th century, leading to the creation of a welfare state, and more through to where we've been now, efforts of combating disease risk and systems thinking, and to reach where we are now, a fifth wave of integrating the true, that's the science, the good, that's the ethics, and the beautiful, that's the aesthetics. And when we think today about the communications needed to win hearts and minds, that beautiful is a very important part of it, hence that it's an art as well as a science, of course. And all of those are important, and we need to take them into account as we look forward to, well, what is it that we want the workforce to do? And probably it is those things that I've described here as a fifth wave. And whether you see these as new challenges that are arising now, or a continuation of old challenges but having to work differently, it all is of the same ilk. And of course, COVID-19 brings something new to the table. It certainly brings an immediacy and an urgency. And it also brings home what we all say in times of quiet, that if we don't do this right, something bad will happen. And we've had the very worst that has happened, and it is still happening. And our hearts go out at the moment to people in India, for example. But it just shows how important the tasks are for public health. I wanted to say a little bit to draw attention to the Public Health Skills and Knowledge Framework, a document published in 2016, and I think you will all be familiar with it, but there's the link for it. And I call this the link to public health workforce planning. Back in the Middle Ages, when nations carried out diplomacy, the diplomats all spoke in French. So that in that way, they all knew the words, they all knew the meanings of the words, and it reduced the likelihood of misunderstandings between the diplomats. And today, lingua franca has come to mean a kind of any common language for any common endeavour. And for me, the framework is a lingua franca for public health. It's used and adopted in all of the 4 nations of the United Kingdom. It has a set of standards and descriptions that we all adopt. And I find that very helpful. And there is a plan. It still hasn't been implemented, but it would be good if it was, for the digitization of the framework so that individuals can visit, they can log in, they can have their own account, they can store their documents relating to their career and the measurement of their competencies there. They can assess themselves against the standards in the framework. They can identify the gaps that they've still got and even the ways they will need to proceed in order to fill those gaps. Similarly, employers can log on and they can use the framework for their gap analysis at the workforce level. They can use it for determining their future job descriptions for people that they're recruiting and generally make use of it. And for people who are interested in public health, members of the public, other professions or whatever, it's possible to visit then and be able to see what public health is about in a simple and straightforward way. There'll be case studies that people can view to see how it's been applied and what it means. And I think it's a really kind of valuable way forward if we make the most of the framework. I do mention a comparison that there is a new international framework for competencies in public health that's been developed very, very recently. Just so that you see that the rest of the world is on the same page, and arguably kind of we were there first. I just want to say that it's a long time since the UK had a workforce strategy for public health that was UK-wide. And as I show on this slide, we've all gone our different ways. In England, there was a publication by Public Health England in 2016 called Fit for the Future. It wasn't particularly meant to be a workforce strategy, but by default, it became such a thing because there was no government response. And that's been worked to until we've had the announcement about the public health reforms that Maggie referred to. In Northern Ireland, people are working to a document called Making Life Better, which is a long-running document, a decade long, and covers health and social care, local as well as the government. And it contains a number of ambitions about improving people's health and well-being in Northern Ireland, not specific about public health, but implicit. In Scotland, there was a really good, I thought, inclusive, participatory debate about public health reform. It lasted for a number of years and led in part to the decision to create and launch Public Health Scotland. And Public Health Scotland's now produced its first strategic plan as an organisation. Some strong themes on the kind of areas of policy that Public Health Scotland will focus on, the kind of outcomes they're looking for in public health, in health and in well-being. And again, the workforce items are mostly implicit in the document. In the first of my workshops, Fiona from Scotland was telling me that there might not be a workforce plan yet, but there's a lot of discussion about workforce planning, and that most people are involved from national government to directors of public health, as well as Public Health Scotland, which is encouraging. And in Wales, last year there was a new strategy published for workforce in health and social care, which covers obviously NHS, public health and social care. The danger for us in public health is that we do tend to get lost in an overall strategy like that, because we're quite a small profession. Obviously, there are lots of other disciplines that also get lost in an overarching document like this, who can make the same point. I think there is an issue for me about public health because it's multidisciplinary and population-based. There is something that's different And whilst I don't ask for special treatment because it's different, I do ask to see it recognised and articulated that it's different, and therefore some things need to be adjusted because of that in terms of workforce planning. So Maggie Ray has told us a lot about the planned reforms of England's public health, so I won't repeat what she said. What I will say is that we have had announcements, health promotion, and we've had something about Public Health England's workforce being protected from compulsory redundancy. But what we haven't had yet is any pronouncement that I've seen from any minister about the workforce issues. I think the workforce was the most valuable part of this, and treat them as the first thing to talk about, not the last. But unfortunately, that we're still waiting for the details of public health workforce. In the absence of there being an announcement, of course, we heard also Maggie encourage us to lobby, and it's worth saying the things that matter in public health to those who make the decisions in order to try to influence those decisions. And the point that I want us to kind of consider from my workshop is moving from this structure on my slide. There's a very long-lasting structure of the public health workforce. This idea of the pyramid, where at the top there's a very small pinnacle of the specialists who lead the profession. And then there's a middle band of practitioner, and then there's a very broad base of the wider workforce. And we know from a Royal Society for Public Health publication that there are 15 million paid workers and 5 million unpaid workers in the UK who contribute something to health and well-being outcomes. And so that's a pretty big wider workforce. And so my argument is that in that context, this pyramid structure, it doesn't tell us a lot about how we should organise our public health workforce. And so my next slide is to move on to maybe a different model that would be a bit more informative and a bit more helpful when we're doing workforce planning. And so this is my model. It's my attempt at a solar system. And I chose a solar system because to me you're all stars for the work that you do. And by all means, add comments here in the chat as I take you through this slide. I'll just explain the things that are on it, and then let's have a look at what people are saying in the slides and see whether there's something we can take away from today that's helpful. So in the middle of my universe are the directors of public health. That's absolutely in line with what Maggie's just been saying, and I, like her, believe that that's where the leadership of public health should come from. In every sense, and therefore we need to have a trained body of leaders who are capable of being directors of public health. And then around them is their leadership cadre of specialists. And I've raised here with the specialists credentials, which is something that's coming in medicine. The General Medical Council started to work on credentials, and they were a little bit concerned about the proliferation of specialties and subspecialties in medicine, and have looked at credentials as a way of assuring people's competence in a defined area of practice. Not a million miles away from the defined specialist category of registration that the Public Health Register had in the past, but bringing that up to date in terms of credentialing people for the jobs that they do in public health. And that's kind of my idea about how the leadership should be structured. And then comes the day-by-day workforce in public health, from commissioning services to directing services to delivering services by practitioners, and I have said here advanced practitioners. I well know that the register hasn't introduced a category of advanced practitioners, and as a result the register has a very broad range of meanings and competencies within its registrant class of practitioners. But a lot of employers haven't waited for the register to move on this. They have devised advanced practitioner jobs with job descriptions and job titles, and they've moved on anyway. And I think we need to catch up and understand what we mean by different levels of practice by practitioners and how they fit together. And that's particularly important if you're looking for a career path in public health and you want to know where your next step is. And then around the outside, the people we want to draw into public health and become the practitioners the specialists and the directors of the future. So apprentices, we do now have our first degree public health apprenticeship, and it is one that can lead to registration with Public Health Register as a practitioner. We're always on the lookout, aren't we, for new recruits coming in fresh, and also people are coming in from other careers. And talking about that wider workforce, it hides a lot of different kinds of experiences of public health, some of which are really quite intense and valuable immediately, some of which are a little bit more infrequent, a little bit more distant, and the people coming in will need a little bit more training to bring them up to the competencies that we need from them. But all of those people are valuable and to be encouraged. And for them, I think it is important that there are career paths that people can see in order to be attracted to come into public health. And on the last slide that you'll get with your pack is that I'm happy to take comments and questions afterwards, and here are my kind of personal details, and I truly mean it, that you are welcome to contact me afterwards if you want. But I'm going to put this slide back in place. And I ask you to kind of think about this model and whether it does anything to help us. And if you do it differently, how would you do it differently? I'm looking back now at the chat, and I see Susan is saying she struggles when considering public health frontliners. And I can only say, I know what you mean. But even when there are people in jobs that we now call the wider workforce, and they do come into contact with the public and deliver public health interventions, and that covers lots of professions. I mean, from the blue light services through social care and education and all sorts of settings. I do think that what's definitive about a skilled public health workforce is that one of our skills is engaging the right people, equipping them with the right ability to deliver their intervention effectively and with responsibility and accountability. And so it's that kind of, if you like, it's the conductor conducting the whole orchestra. It's being able to manage the service so that we get the outcomes that we're aiming for. That's special, in my view, about the public health element. Let me just see if there are other comments in the chat. Before that, thank you for those who've given me your job descriptions. As I say, if you just read through job descriptions of people in public health, and you just see how varied we are, and what the range is of people and their skills. And let's just have a look at Holly's added a comment. Holly, yes, you see people in public health practice who are placed in housing. Engaging with officers. I mean, the services that, for example, housing associations to deliver to their residents, they go way beyond collecting the rent and mending the repairs, don't they? In terms of encouraging people to make the most of their lives and to stay healthy and happy. And that's particularly relevant with sheltered housing for people who are disabled or getting on in years. So yeah, I mean, public health gets everywhere, and that's what's so important about what we do. And Susan, you've added it's about empowering them to see that they have a key role too. I totally agree. In a way, what we want to do is to listen to the people who know their audiences and learn from them and take into account what they've got to offer in terms of the planning of an intervention, for example, so that we can genuinely say they're co-produced interventions. So yeah, I totally agree with that. And Jacqueline, you say you provide bespoke training and CPD for colleagues who might not be in the public health workforce but have a role. And certainly, as we go forward and we want to attract the brightest into public health in terms of careers, I do think that openness and enabling people to be able to dip in and see what we're about is really helpful. Some of the practitioner registration schemes offer masterclass sessions for people who want to register as practitioners, but they throw them open to wider audiences. And I do think that's the way to go. So I think we've used the time that we're supposed to be using for the session. I think I've set you a task to do some thinking and maybe suggests a little bit of lobbying to people after today. And I hope you found the whole session useful. I've enjoyed talking to you, reading your comments, and I hope you have enjoyed the session as I have. Thanks very much. By all means, do carry on with the next part in the session, which I think is a networking session. Thanks very much, everybody, and bye.